Well, welcome everyone. My name is Cindy Marie Absey, and I have the privilege of serving as co-president of the League of Women Voters of San Luis Obispo County. Thank you for joining us today for a panel presentation on homelessness, the first of a series of presentations the League will host to better educate our members and the community on the growing epidemic of homelessness in San Luis Obispo County. Earlier this year, homelessness was identified by our members as one of several priority issues for our league. To give some perspective, San Luis Obispo County ranked third in the nation for the highest unsheltered percentage of those who are homeless for a largely suburban area. And that's according to the annual homeless assessment report to Congress in 2019. That percentage, if you're interested, is 79%. And I'm sure our panelists will be discussing that as we go along. Make no mistake, homelessness is a crisis in our own backyard, and this year, COVID-19 has deepened that crisis to a heightened state of urgency. By learning more about the current state of homelessness, the League will lay the groundwork for action and advocacy going forward. Today, we have invited 3 local experts in homelessness to share their knowledge and experience with us through a moderated discussion and by answering questions from you, our audience. Now I will introduce our panel members and our moderator and provide a brief snapshot of their backgrounds. Wendy Lewis is President and CEO of ECHO. Wendy grew up in Lompoc and attended Cal Poly. Prior to joining the El Camino Homeless Organization, ECHO, in 2018, she worked at the Food Bank Coalition for 10 years, rising to Chief Operations Officer. Since joining ECHO as President and CEO, she has greatly expanded the staff and service capabilities of the organization. Next, we have Grace McIntosh, Deputy Director of CAPSLO. Grace has been Deputy Director of the Community Action Partnership of San Luis Obispo County since 2009. She has worked in the nonprofit sector for 35 years, including as CEO of the local American Red Cross. She was one of the 2018 San Luis Obispo County Women of Distinction based on her work developing innovations at the 40 Prado Homeless Services Center. Just one moment. Thank you. Janna Nichols, Executive Director of the 5 Cities Homeless Coalition. Jana became the first executive director of 5 cities in 2012. She has many years of leadership experience in nonprofit service organizations, boards, and commissions. She also serves currently on the San Luis Obispo County Homeless Services Oversight Council. And in 2017, she was named a Woman of Distinction by Cuesta College and the Women's Legacy Fund for her work on Progress for Women. We welcome our 3 panelists. We're very fortunate to have you with us this evening. Panel moderator Marlys McPherson. Marlys has been a member of the San Luis Obispo League since 2007. For the past 4 years, she has served on the Morro Bay City Council and is the city's representative on the Homeless Services Oversight Council, which makes recommendations for services and funding to the San Luis Obispo County Board of Supervisors. She is also the city's representative to the Estero Bay Alliance for Care, a consortium of service providers for the homeless and low-income residents on the North Coast. Welcome to Marlys as well. With that, I will pass the baton to our moderator, Marlys McPherson, to give an overview of the process and guide the panel discussion and Q&A. Thank you.
And thank you, Cindy Marie, and welcome everyone. It is my pleasure to be moderating this panel tonight because this issue is really tremendously important in our county. When I was first appointed to the as the city's representative to HSOC, which is the Homeless Services Oversight Council, I knew very little about the homeless problem in the county. And serving has been a very real educational experience for me, and I have learned a lot from these 3 panelists. Our purpose tonight is to provide an introduction or overview of the homeless issue, and this is how we're going to work the session. I have several discussion questions that I will pose to the panelists and they will answer in turn. and then we are going to leave time at the end of the session so that we can answer any questions from the audience. The webinar is scheduled to end at 6:30, but our panelists have agreed to stay until 7 if there are additional audience questions to be answered. So to those of you in the audience, and I can see we now have 55 joining us, this is wonderful. Please use the Q&A button to enter your question at any time during the webinar, and then we will collect the questions and ask the panelists to respond following the discussion. So let's begin with the big, broad question. How serious is the homeless problem in San Luis Obispo County? And can you describe who the homeless are and why they are homeless? And let's start with Grace.
Thank you, Marlys. I'm just thrilled to be here to talk about an issue that I'm obviously very passionate about. So I appreciate being given the opportunity. So that is a meaty question. You know, homelessness really results from an accumulation of adverse social and economic conditions, anywhere from health, income disparities, racial inequality, housing affordability. These are all issues that the homeless in our community are affected by. So, you know, when you say how serious is it, whether it's one homeless individual or 100,000 homeless individuals, it's serious. It is an individual and I would say a societal tragedy that we are grappling with in this country. You know, we're a small community. San Luis Obispo, has about 280,000 people, I think, all told. And yet the proportion is significant. As you know, as Cindy Marie stated, 79% of those who, in our point in time count in 2019, it was just under 1,500 people, were unsheltered. That means that they had literally no roof over their head. They were sleeping somewhere that you and I would probably find completely inhospitable, or couch surfing or a variety of things. So how serious it is? It's a tragedy. It's very serious. Who are the homeless? Well, I can tell you who the homeless are in SLO. They're getting older. That's the fastest rising number that we see at 40 Prado, are 65 and over that have medical conditions. We have a large number of our participants are struggling with mental health and substance use issues, or the dually diagnosed talk about. They are single for the most part, and they are grappling with the sense of having no roots. They belonged to someone at some point. They were somebody's mother or brother or sister, and they still are, but they have nowhere to go, and so they come to our shelter. The homeless could be anyone. And that's really what I think we want to focus on. It could be any of us at any point.
So just to follow up, is it more men or more women?
For us, and I think that bears out, the statistics will show it's primarily men, single men. And that's about what we have. About 65% are single men. And again, the largest population that is growing are elderly for us.
With health problems, you mentioned.
Absolutely.
Okay. Wendy, what can you add to that?
I also want to thank everybody for this opportunity. One of the things I think is most needed is education, which this is providing. We in homeless services hear so many different ideas of what people think are happening, and the realities are somewhat quite different. One thing Grace touched on it, that these are people from our community. The last point in time count, 74% of the people who were counted were born and raised in our community. So it is our neighbors. It is someone you might have gone to high school with, or a child of someone who you're friends with. It is every demographic we have seen, from very low economic status to people who were CEOs at companies. It's that entire spectrum. I also like to, you hear homeless crisis so often, and I really look at it as a humanitarian crisis. These are people in our community that need help, different type of help, depending on their story and their path they're now on. and it's not hopeless. It's the other thing. A lot of people see it as this huge crisis and it's hopeless. And all of us in homeless services know that people with the right resources get housed. It just takes different pieces put together with that person doing some hard work with our support to get into housing. Last year, 60% of the people we served at ECHO found housing. So there is hope. The biggest perspective or issues are, I think, lack of understanding, not enough shelter beds. Last point in time, Grace mentioned almost 1,500 people. And I think we have in our county about 350 shelter beds and then some domestic violence, but there's that gap. And if there's no place for someone to go, what's the alternative? So lack of shelter bed, lack of resources, and I'm grateful for our partners on the panel because we are so collaborative. And I think that's a key. And we need to grow that collaboration throughout the community because it's going to take not just people in homeless services, it's going to take business community, government, the people to really solve this, not just homeless service agencies.
Okay, thank you. Jana, maybe you'd like to begin by telling us about the point in time count. It's been mentioned a couple of times, and this is one of the ways that we learn about the homeless and how many we have here in the county. And I know you have been involved with that.
Sure. Every 2 years, we are required by HUD to conduct what is called a point in time count, where we literally go out one morning. A lot of volunteers, many volunteers throughout the county have assisted with this. We literally go out in the morning for about 3 or 4 hours, and we do a visual count of those that we see, those in the encampments that we know of, those that are parked on the street, and certainly then all of the shelter beds that are in operation at the night. And then we follow that with a survey, a sampling that we do with folks, and we ask some more specific questions about what their circumstances are, how they found themselves homeless, et cetera. And so we do that every 2 years. And the last one we did was in January of 2019. We have been asked to do it again this January coming up. We are in discussions about that. And certainly anyone who's interested in volunteering, I know that collectively the county oversees it, but I know that there will be a cry for volunteers to assist with that. And we're looking at some different ways to do it with regard to COVID safety, et cetera. To your question, I don't think I need to address the seriousness. I think Grace kind of hit the hammer on the head. For me, I think it's important to recognize the WHO is very specifically tied to the housing and income options. What we see certainly in San Luis in Southern County is it's low and moderate income people. For example, 48% of the people living in Grover Beach are low and moderate income. 14% of them are living in poverty. It's very specifically tied to income. Then you have an issue of your housing inventory. And we have less than a 5% vacancy rate in the county. So if you don't have housing and you don't have income, what you're seeing is a 50% increase in rent in 5 years. And there's a tipping point. There's quite a bit of information that says if you spend more than 32% of your income on rent, you are at risk of homelessness. And the greater that percentage within a community, the greater likelihood that people are going to fall into homelessness. Well, here in the county, we're at 38%, and those of the Latino Hispanic background their rent cost burden is more than 50%. So if you start looking at the WHO, again, it goes directly to income and housing accessibility. And I think you're going to hear that theme throughout the evening. The why is very specific. It's we're in a crisis economically, and you're going to see more of it. I'll conclude there because I think there's a lot more to be said, and we're going to talk more about COVID here in a few minutes. But there are a lot of other contributing factors. So there's mental health and there's addiction, and those are the things that immediately come to people's mind, and they are certainly real. but that is certainly not everyone within the population. And I challenge you, if you find yourself on the street homeless, I can guarantee you hopelessness, depression, mental illness is going to be a significant factor in your state of being. So our challenge is to help people out of their immediate crisis and help them see forward and see hope, as Wendy mentioned.
Marlys, do you mind if I add something real quick to that? The point in time count is a snapshot on one day every 2 years. And we know we're not counting everybody. So it is, right about 1,500, but we know there's more. You're not going to reach everybody, even if you have, your teams of volunteers. Some people in our community, they're really dug in and you're not reaching them. So that number is, what we go by, but it's probably a very low number to be using compared to what's really the reality.
No, I realize they do it more to track across time and jurisdictions. So it's more for those purposes than really trying to get a total count of all of the homeless. I'd like to ask a follow-up question to this. The three of you are service providers, but we know that there are people that do not seek services. So what proportion of the homeless actually refuse services? And I'll start with Grace. Go ahead.
You got to take turns. No kidding. So what proportion, that's a real challenging one because Marlys, you've got individuals who are at very different points in their lives, who are struggling with different things. I don't think the word refuse connotes a certain attitude, and I'm not sure that a lot of folks would necessarily refuse, but there are issues that do not enable them to participate. I'll give you a concrete example. Actually, in your own backyard, we cover Los Osos and Morro Bay in some of our outreach activities. And as you well know, that there are encampments there. There are folks who park in areas. And Los Osos particularly has been really grappling with those issues as of recent, but they are certainly not alone. The entire county, municipalities, everyone is dealing with this. So, we go out and we meet with these folks, and a large issue is developing relationship. If you just go out and say, hey, you want to come to 40 Prado, you're probably going to hear a lot of no, forget it, I don't want to come to 40 Prado. It's the development of the relationship, and that can be a very long process with a lot of ups and downs. Someone who might refuse today, in 2 months, they may not refuse. So really you have to look at where that person's at. You'll hear me say that a lot. We use that a lot in harm reduction kind of philosophy of treatment, seeing a person where they're at and then beginning to kind of meet them where they're at and then working with them from there. So when you say how many people refuse, we've had people refuse to come to 40 Prado because they don't like our rules, because they want to stay in their car and we don't have any more space in our safe parking program, because they don't really know what 40 Prado is about. And so we try to tell them what 40 Prado is and what 40 Prado isn't. And many of them prefer to be where they're at. And we believe in the right for them to make that decision if they are of sound mind. I'm a social worker, and so I believe in the right to self-determination. And if someone chooses to not come, and we've made efforts and we've reached out and we've provided them with information, and they choose not, that doesn't mean that tomorrow they won't choose to. So I know I probably haven't answered the question to your satisfaction, but it's a very difficult issue.
Yeah. Jana, could you also contribute? And I think what I'm getting at is we know that there are people in the encampments while you still may have some empty beds at the shelter. So they obviously are preferring to stay in an encampment. And I just wanted to find out approximately how many people are in that situation and why they are. So go ahead, Jana.
Oh gosh, we could spend the whole night on that very question. there's a lot. There's a growing number of people in the encampments. I will say that part of it has to do with, for example, with COVID, we have diminished our population of those who are incarcerated. So where did they go? If they couldn't go home. But I'd like to go back more specifically to the refusing of services, because people who have been traumatized for one reason or another, they may react very differently to situations, and it may take that time to build that relationship. One instance that comes to mind is we were doing outreach, and we finally developed a relationship with a guy who had been out for 5 years. He had not sought any services. And with that relationship, then things began. And within a year, we had him housed and in a great shape. And, I think we all probably have that story. I have one situation where we had 2 teenagers. They were dealing with addiction issues. We got them set to go to detox and begin their recovery. And on 4 different occasions, they didn't show up. And I told the case manager at the time, I'm done. And he says, you can't give up on them. I said, no, I can. He says, no, you really can't. And the 5th time was the charm. And now they are proud parents of a young child. They are working. They spent some time at Wendy's place. They're in good stead. So to Grace's point, it is a matter of relationship, and it's also a matter of where they are in their life. I will certainly say that the older people get, the more frail they get, the more open they are to services, unfortunately. And we'd love to address that earlier. But it's outreach, but it's also having those options. And if you don't have those income options, or you don't have the supportive services options, and you don't have a housing option, then coming in for shelter in and of itself may not be what they want. And that's where I applaud all of the work that we do in terms of our case management, because it is that conversation of helping people find a path forward, and they may not see it on their own.
Okay, thank you. Anything to add, Wendy?
Yeah, I mean, Grace and Jana said it first. I mean, I wrote down the word relationships before they even said it. It really is finding the right point in time in a relationship, or that person being ready. It's all about their readiness. And this topic, or this question, is one of the biggest misperceptions that we deal with, especially in North County. I hear this so often from the community that, oh, they're all just choosing to be in the riverbed, and they all don't want to be in a shelter. If you build a second shelter, nobody's going to want to come. And I can give an example. Our work that we're doing in Paso Robles now, bringing on a second facility, we had been the past month, because it's so cold, offering emergency shelter at one of the motels. And prior to us having this up and running, we heard from the community, nobody's going to show up at that motel. They're going to stay in the riverbed. And within a few days, we had 35 people waiting for a room. We only had 13 until today. We now have 50, because we actually were able to partner with SLO and People Self-Help Housing. And we have a big project that we closed escrow on today. So I'm happy to say that we have 60 more shelter beds in our county's network. And so it's really about finding the right connection with the right case manager, right outreach worker, to get somebody open to that conversation and ready for resources.
Well, this is the right transition, because the next question is, what are the services that your agency provides, and how are you funded? And we are starting with you, Wendy, so you just keep on talking.
Right. So funding is, fun in the nonprofit world. We, for the most part, rely on the community, the caring community who wants to be part of getting someone back into housing and just providing an emergency place for somebody to go. We do get federal and state funding through the county. We don't currently get a lot from our cities. That's a conversation we're having. It's really primarily the community support. Right now, there is quite a bit of government funding coming through the CARES Act. We're all trying to grapple with figuring out all these different channels of federal and state, and three of us, work in a collaboration to try to get the most, to be the most effective. So really, it's the caring community that helps us do our work. Programs we offer. We've grown that ability in the past 3 years pretty dramatically. So physically at Echo and Atascadero, we have a program type-based shelter where it becomes their home for 90 days. They are case managed and have a case plan tailored to their needs. We have financial literacy, we have parenting classes, garden education. A lot of people don't realize how many kids, unfortunately, are facing homelessness. And so we have half of our shelter set up for children. So we have as many children programs as possible. Tutoring, schoolwork help, garden education, all kinds of literacy classes. So it's all really about wrapping around services around the folks that need it. We treat our environment like a giant home for 60 people, and what we would want to provide for our families is what we provide here. We also started in the past, 8 or 9 months, some outreach into the community. That's been new to at least our agency. Before that, you would physically have to come to Echo in Atascadero to get services. And now we're out in the North Coast, in Paso Robles, in Atascadero, meeting you where you're at. We also here at Echo offer an evening meal to anybody who's hungry. That's where a lot of those conversations start to get people ready for services. We have a shower program Monday through Friday, and we'll be doing the same in Paso Robles, kind of mirroring what we do here. Paso Robles, though, it's really going to bring some low barrier beds into our community, which is a critical need. That's that first step into getting into a shelter and then moving them throughout the housing spectrum. So we're really proud of the programs and the services we offer.
Thank you. And Jana, you want to go up next and talk about your organization?
Sure. I think it's important. One of the things I'd kind of like those attending to understand is while we each represent certain areas, or we've divvied up certain areas of the county. So, for example, obviously I'm Five Cities Homeless Coalition, but we're focusing in South County. We also are very conscious of making sure that we don't overlap. And so we all have different niches within the service spectrum that we provide. So with regard to South County, we do not have a year-round shelter. We do operate a winter warming center. We will be opening next week, and it is open on cold and rainy nights. We will be opening at the County Regional Center in Arroyo Grande this year. And that we have a mechanism by which that we look at the weather and make those determinations. But apart from that, we don't have a shelter in South County. And so we work very closely with Echo and Capslow to try to shelter those that we can, even if they are in South County. Our focus predominantly is around trying to find housing and to prevent homelessness by eviction prevention. And so we provide countywide services in terms of housing assistance for rent, deposit, et cetera. And we work with our partners again to help support those clients that were there. But we are the rapid rehousing and homeless prevention. That's our main focus. Additionally, there is a growing population that I didn't address earlier of homeless youth, 16 to 24-year-olds. Who are unaccompanied, and there's a variety of reasons why that's happening, but it is probably next to the aging population, the population we should all be most concerned with in terms of the rapidity with which youth are falling into homelessness. So we have launched a very specific, again, countywide program addressing the needs of that youth. We're working very closely with Cuesta College, for example, and Hancock and others in trying to address that. One of the things I mentioned, I know, is about the issue of income. And if someone cannot gain income, they're not going to get back into housing. So we have a very specific program focused on benefits acquisition. I have someone on staff who speaks Social Security. I do not, but he's great in terms of navigating that particular issue in terms of trying to help people find the benefits to which they are entitled, particularly those that may be disabled. And in general, we are also out doing outreach. We have each divvied up the county. So I have an outreach team that is focused very specifically in South County, trying to address the needs of those that are in camps or street parking. And again, we work very closely with each other, and I'm sure I've forgotten a half dozen programs. But I guess I should talk a little bit about the coordinated entry process. Grace may want to mention it, but Capslow is the lead agency, and the three of us are the three entry points for coordinated entry. I'll leave it at that in case Grace wants to talk more further about that.
Okay, Grace, you're up.
So Capslow, as you probably know, Marlys, is a larger agency. We're celebrating 55 years, and we do a number of services from Head Start, migrant seasonal Head Start, to veterans services, to a number of services. I'm assuming you're asking what services does 40 Prado provide. So, you know, when we started the concept of this 40 Prado 24/7 facility, the thing that we really wanted to emphasize was a coordinated and comprehensive approach to providing services, sort of a one-stop shop, as you have it, because in talking with the community and with other providers and folks that have just been advocates for so many years, two things really came out: is that the major needs, access to care was a huge barrier for the homeless, and then connected with that was case management, but really access, trying to navigate all of the various different services and getting there and scheduling and all of that. So we set out to have services there on site for folks. And those services include CHC, Community Health Centers, which is the primary medical care provider for low income, has 2 medical exam rooms that are there on site. We have CHC physicians that come and provide services, not just to our folks, but to anyone who is Medi-Cal or Sen-Cal in this community eligible. We started the county's first warming center in 2010, the county's first safe parking in 2009. In 2017, we started the first recuperative care, which is a medical model very focused on high needs medical areas. So we have 6 beds that are dedicated to folks coming out of the hospital who, again, otherwise were being discharged literally to the street. And so we provide targeted case management, and we have an RN who works hand in hand with CHC. And it is so important having CHC there on site, because we're dealing immediately then with those post-discharge issues. SLO Hub, that harm reduction program that I talked a little bit about, that was funded by SAMHSA and was actually designated as a best practice, one of the top performers for 2 years in a row. And that's dealing with individuals that do have that dual diagnosis, substance use, mental health issues. We have an on-site county behavioral health therapist, huge, that has been tremendous, who does have the 5150 privileges, who also is working hand in hand with getting our folks to county mental health. Again, access, making sure that they're going, making sure that they're taking their medications. We have, the big one, we'll be breaking ground next month on the county's only medically assisted withdrawal treatment program. And Robin's going to kill me, but I'm going to say detox, where it will be on site at 40 Prado. The county, however, will be the licensed entity, and that's going to be 8 to 10 flex beds, dealing with individuals that are trying to escape the ravages of drug and alcohol use. So our focus at 40 Prado is really trying to deal with the whole person. We are certainly more medically focused because we have CHC there. And I thank goodness because of the population that we're seeing. Again, I'm going to keep coming back, and I know Jana's right there with me, the elderly. If you come to 40 Prado and people, in fact, I had a lady came yesterday, And one of the first things she said was, wow, you have a lot of elderly people here. I said, yeah. They don't have anywhere else to go. So we need to have that medical focus, the mental health component on site, because these are the issues that our people are bringing.
Okay, thank you. And I think Wendy wanted to add something. Go ahead,
Yeah,
Wendy.
it's so new into what we're doing. I forgot to mention, this is our first winter of offering an emergency winter shelter in Atascadero as well. So we have our physical shelter that's program-based, 60 beds, and we're offering a 23-bed emergency winter shelter starting from November 1st through the end of March, because it is so cold up here and there's just not a lot of places for people to go. And then another thing I forgot, which is so important, because so many people have the misconception that people who are facing homelessness aren't willing to get a job, aren't willing to work. And as Jana mentioned, it's key to getting back into housing. We have a workforce development program that helps people navigate from, getting a resume, job interviews, not doing the work for them, but getting them ready to work. So it's one of the key factors into successfully getting people housed is the income level when they're eligible, not when they're the 80-year-old that had the medical, the stroke, ends up at our doorstep with no place to go. Their path is very different from the 20-year-old who doesn't have those life skills and doesn't know how to get a job. Thank you for letting me come back.
You're welcome. Okay, now we're going to talk about COVID. How has the COVID-19 pandemic impacted both the homeless population and your ability to provide services? And we're going to start this time with Jana.
Could I just say quicksand? I'm sorry. So let's talk with our clients, what we're seeing within our community first off. So we have tenants who have lost income, who are having problems paying their rent. We have landlords who have lost income because they're not seeing rent. There is an eviction moratorium in place through the state that will be lifted January 31st. And we have parents who are, again, either without jobs, or they're paying for childcare, or they're having to stay home for the child and not go back to work. So you have an income disruption, and the eviction moratorium is about to be lifted. And so quite honestly, we as an agency and collectively are bracing for a tsunami of need, which leads me to the impact of the agency. We have seen, we're currently seeing about double the requests that we did at the beginning of the year. Initially, in March, when COVID hit, we scrambled to try to identify some shelter at home opportunities for our people who have no home, and initiated some programs around case managed camping for some select clients. We were very successful in moving those clients into housing or reunifying them with families. So we are trying to work with the various jurisdictions to help us recreate that model. We only operated it for a couple of months, but we are looking at that. Certainly with regard to the issue of congregate shelters, there are safety protocols in place, and so we're having to respond to that as well at our warming center. And our office has been virtually closed since March. We open 1 or 2 hours a day for rent and immediate assistance, but 90% of what our work is now being done is virtually over the phone with our clients. We're still meeting with clients on a limited basis, but we are close to walk-in traffic. And that said, we're still seeing double the number of requests that we were at the beginning of the year. Other than that, I will say that there certainly has been an uptick in the number of folks in encampments. There's lots of reasons for that. I think I've addressed some of those. And the issue of funding, people may be hearing about COVID grants coming down as part of the CARES Act. In general, that is true, although we have yet to see the contracts or the money. So we are all collectively being asked to spend and respond without actually having been fully funded at this point. So it's we're trusting everybody at their word, and I don't mean to speak poorly about that, but There have been changing federal regulations since this began. And I think collectively, including our government partners, we're struggling to stay abreast of all that's taking place.
Thank you. Grace, do you want to go next? Does this jive with your experience?
Quicksand, shifting sands, as I say it. But yes, so how did COVID affect Forty Prado? Well, of course, we had to, we are a congregate care facility, but we also know that our elderly folks don't have anywhere to go. They're certainly not going to go out to the street. We did everything that we possibly could. We put up plexiglass everywhere. We masked everyone. We reduced our numbers. So normally we are 100 plus overnight option, and we went down to 70 so that we could distance as much as possible, sleeping head to toe in the dorms. We put plexiglass between all of the bunks, and put in strict PPE requirements, cleaning requirements. Goes also to our warming center. We did have to reduce the number of cots in warming centers so that we could distance and separate. It's been a very, very trying time. I agree with Jana. I think we're looking at a tidal wave. My biggest concern, even though there is all this money coming, and the desire, of course, is to keep people in their homes if we possibly can. But the rapid rehousing piece is what concerns me the most because of two issues. Number one, at income. At some point, they're going to have enough income to stay wherever it is we place them. And number two, housing stock. There simply isn't any. And so, I think Jana alluded to what are we, the fifth, or we have 5% rental vacancy rental rate. So where are we going to put these people? And that's when I get scared and freaked out, because I think, okay, well, they're going to come to me. They're going to come to our shelter, and we don't have enough beds. There aren't enough beds in this county, as Wendy alluded to. So ergo the encampments. We're trying to expand our safe parking even further. We're looking at additional locations for those who are fortunate enough to have vehicles. But COVID has really thrown all of us into uncharted territory. I agree with Jana. It's very frustrating. We want to get going. We want to gear up so that we can address the issues that we know are coming next month. And yet without funding, how can we realistically be, called upon to tackle this issue, with a lack of funds? So that's a huge problem.
Thank you. And I know there is money available, but you're suggesting that it isn't getting to you. Is that
right? And again, we're not pointing fingers at anyone. It's certainly not the county, because it goes to the state or it goes to HUD. So I think, if you look at the issues just at the federal level in terms of constantly changing COVID requirements and regulations. So this is uncharted territory, I think, is the biggest thing. Ergo the quicksand.
And Wendy, are you in quicksand too?
Well, ironically, the quicksand actually brought us the project in Paso, which is kind of, an irony of this whole thing. The funding for that came through the CARES Act and Project Home Key, which was generated from the state. So it was CARES Act funding coming to the state, and then the state of California had Project Home Key, which gave funding to organizations to build emergency shelters that weren't a congregate setting. So what we mean by a congregate setting is a big room with a bunch of people in it. What motels are perfect for non-congregate shelter, which protects from COVID. So ironically, quicksand led to a really good thing that will be in our community's resource system for a long, long time to come. But how COVID's really hit us the hardest is, just making sure we do everything in our means to keep the people we serve safe, our staff who are showing up every day. Talk about essential services. We can't shut down, or we create more folks that are facing homelessness. So physically at ECHO and at our emergency shelter here in Tascadero, which was graciously donated by the Tascadero Community Church. They're lending their space for that. We had to do everything with a COVID lens, limit number of folks, dividers, sanitation like crazy, environmental spray, everything we possibly can do. So, we're doing that throughout our care system. But the other thing it critically did was it eliminated 60% of our volunteers. We rely on volunteers to help come serve meals, help stay overnight, and talk about taking 60% of your volunteers out of your system. And then staff, we were working more than we've ever worked. So your staff who you want to take care of, they're getting worn down. We're finding staff right now is even problematic. So COVID is affecting us in so many ways, but the bright spot I can share is here at ECHO and in Paso at our meal programs, we had to shift to go style for the people who aren't staying with us. And part of making that happen is the people we serve that stay with us. They pack the meals, they help keep ECHO clean and safe, extra sanitation. They're really stepping up because they want their home to be safe as well. So a couple silver linings in a really weird year.
Okay, well, the next question you may have already answered, but if you can think of some more, it is, what are the critical challenges your agency is currently facing? And I will start with you, Grace. Have you covered them, or are there more?
Critical challenges. Well, I echo Wendy's comment about volunteers. We lost everybody. Our evening meal program, although we did not lose, I will give a shout out to People's Kitchen. They continue to come every day and do lunch, but that significantly impacted our budget. Obviously, our big issues are continued access to mental health and substance use. I think it's a very, very challenging if you're living on the street and you're struggling to get the appointments and keep the appointments that are really necessary. So that's a struggle financially. Again, I think all three of us, for us, 2/3 of our budget is funded by private donations. And so we know that that's going to be a challenge because economics are changing. So that's a challenge, for us. The numbers of people we anticipate that are going to need us is going to be a challenge, and we want to meet that challenge, and we will to the best of our ability. I do have hope. I do love the work and the people here from all of our providers, whether they're people like you, Marlys, local government officials, to community advocates, to the faith-based groups. There's a lot of caring people out there. And we are a small enough community where we can actually communicate and talk to each other and get things done. So there are a lot of challenges, but I think there's also some wonderful aspects of being here in SLO County.
Thank you. Jana.
I would say the first challenge that our agency has is really what I'm going to describe as our broader community challenge, at least with regard to some of the discussion of the encampments and otherwise. And that is for 5 cities, the location of where to provide services has been a huge challenge. And people are no doubt aware of some of the things that we went through last year, trying to address the need for services, and at the same time not having an appropriate location that the community could embrace. So I will say that that's a universal challenge that I think we have collectively throughout the county right now. And I will say that 5 cities is at the table trying to address that, but I don't have the answer if we don't have the community collective will to make that happen. And that, that has been a challenge. This is now my 4th warming center location in 5 years. So, I will say that it's difficult to find appropriate locations that people can embrace, and at the same time address the issue of the growing encampments that we have. And we have to do something, because one is not going, if we do nothing, we are going to have a continuing rising challenge, and certainly the concerns I'm hearing in our area with regard to the growing encampments is a concern. The other thing I will say is we have a diversity of needs, and I think we're going to have an even broader diversity. We have I think, an impending group of people who historically would not have been homeless but for economic means. And I think it's going to be a challenge for us to, one, I mean, we're working really hard to try to figure out how to address those new needs and not stumble over each other. So I can tell you that Wendy and Grace and I are having almost daily conversations about how to change our systems, how to change our services to accommodate what we think is coming, and at the same time maximize the services and resources we have so that we don't stumble over each other, and that we're able to serve the community as best we can. And I know that Wendy and Grace have both addressed that. And I think the last thing is, to Grace's point of hope, is the question of how do we embrace new energies. And for me, there's a challenge, because we have been working on things that people may or may not be aware of, and yet we have many people who want to help. And so how do we bring that in on the planning stage of things that we have been working on, with the caveat that they may or may not be able to actually physically do something, right? So they have ideas, they want to help. All of these volunteers we had, their desire to serve has not gone away. So how do we maintain those energies, and how do we change that? And I think so. And then we have a lot of folks, obviously, who are coming up with new ideas, which are excellent. But how do we bring them up to speed to the challenges we've faced, and then allow them to help us get over whatever the hurdles have been that have kept us, from one reason or another, realizing some of those opportunities. And then lastly, the fundamental thing, which is we have a shrinking pool of federal funding apart from COVID. That COVID money is going away. Universally, each agency has taken significant reductions over the last several years in terms of the federal funds available. We know that that's going to be more severely happening even on the local level, with some of the economic impacts that our jurisdictions are facing. And so, back to Wendy's point, I think earlier, we are going to be dependent on our community to step up, because the cavalry is not going to be there for us from the outside.
Ooh, okay, Wendy, challenge.
We went from positive to but it's the reality, you know, for all of us, for at least for me, I think we grew pretty dramatically during the crisis to meet unmet needs that we saw that somebody had to step in. For instance, in North County, we added 2 outreach folks that go out just to meet people and provide COVID-related safety items. That wasn't going to happen. And those people weren't going to get the information, weren't going to get sanitizer, weren't going to get masks when everything shut down. So, you know, we've stepped up, and fortunately, others have stepped up to support the work right now. But my biggest fear is sustainability. You know, we're doing more. We're building, you know, a new facility, and what's in the horizon after the 2 years of state funding, you know, we need to sustain that and keep our promises, which I have full faith we will. But it's going to take the community to step up and finding different funding channels. And with COVID, at least for me as a relationship person, and that's how we build, you know, into funding conversations, is relationships. So many of those relationships that you would have nurtured and found just aren't happening because you're not running into somebody at an event, or you're not meeting somebody. So that's one of my challenges right now. But as an organization, I think it's just keeping the messaging going, doing the right thing. And I have a baseball analogy. It's like, if you build it and you're doing it right, it will come. And that's what I'm kind of faithful and hopeful of.
Thank you. You know, it's getting close to 6:30, so I think what I'm going to do is go to our questions, and
they're all good.
okay. All right. The first question is for Grace. Please explain more about what harm reduction involves.
So there is not one universally recognized definition of harm reduction. It's really a public health strategy policies that was developed a number of years ago that really refers more to minimizing or lessening the negative social and physical consequences associated with substance use. So really looking at how do we reduce or minimize the negative behaviors associated with substance use, while we at the same time increase the positive behaviors. So for us at 40 Prado in the SLO Hub project, we have 2 therapists and 2 case managers that are working with these folks, and most of them actually aren't even at 40 Prado. They're wherever. They're in the creeks. They're in the encampments. They're sometimes in housing, and we coordinate and collaborate with the client to look at their substance use in a non-judgmental way, which is really important, and then begin to work with them. And it's intense. I mean, it's 6 months to a year to get them to slowly begin to lessen that those behaviors while we work with them to begin to increase. So it's kind of a, up and down kind of thing. I hope that answers that person's question.
All right, well, thank you very much. Here's the next question. We often assume that people who are homeless do not have jobs. Would you also talk about the working homeless? Is there anybody who wants to take that one? Oh, Jana? Jana's got her hand up.
Well, we see a lot of that, and a lot of that again stems to some of the eviction prevention strategies that we are looking at currently. We have a significant number of single parent families that we are serving, and in particular, and not just single mothers, a lot of single dads as well. And so again, going back to income, if you're making minimum wage, you would have to earn or work 99 hours a week in order to afford a 2-bedroom home. So if you're a single parent or even 2 parents working at minimum wage or low wage, which a lot of our folks are in the hospitality industry, just the amount of work you have to do to maintain your home is significant. So if now that your child is not going to school, and you need to stay home to provide childcare because you're, you can't send them to school, then you have a loss of income. Or in the hospitality industry, as you know, it's been up and down in terms of how often people are able to actually go to work or the reduction. And so there's significant impacts in that regard. But we, for example, at our warming center, and I'm sure everyone has an anecdote. I mean, we have several people that stay at our warming center. We had a guy, we would get him up at 3 o'clock in the morning, every morning, long before we got everybody else up, because he worked in a bakery and he had to get there to start baking. I think there are a lot of misconceptions and stereotypes about who is homeless, and hopefully people are coming to understand that there's a breadth of issues that face people, whether it's economic, age, health, all, and housing availability, all having an impact on our community.
Thank you. And Wendy, did you also want to add to that?
I touched on it a little bit earlier, but it really is, we hear that quite often, that, they don't want to work. They're not willing to do what it takes to get back on their feet. And now that we're doing outreach in some of the encampments, we're finding people are working. They're in an encampment, but they're working. And so we're really looking for partners in the community to expand our workforce placement program. So we work with employers who are desperate for employees who we pre-screen. We get their job descriptions and we match them with the people's talents that are staying with us. And we've been very successful with that. And the employers that we use, they're thrilled because we're doing some of their work for them. And one of our recent success stories is we had a gentleman staying here at Echo, and he had some substance abuse issues and got the right resource and decided to head down a more positive path. And once he got some sobriety under his belt, he started working at Twin Cities Hospital with our placement program. Twin Cities was thrilled because they were having trouble filling, those jobs, and it's a little bit higher wage than minimum wage. So it's a step up. And now he's actually going to be our residential volunteer at our new facility in Paso. So it's just getting people the right opportunities and the right tools to find employment, because it's key to getting back into housing.
And Grace, did you want to add to that?
You know, I see that there's 11 Q&As down there. And so I want to just, for brevity's sake, I think Wendy and Jana did an excellent job at doing that. We also have a large number of working poor that are with us.
Thank you. Thank you. This is a question to all three panelists. There have been tiny house transitional villages operating successfully in cities like Eugene and Medford, Oregon, Seattle, Madison, Austin, and other places. They are cost effective and provide actual personal, safe place and sense of much needed community. Will you be willing to expand your services to such transactional villages? Transitional villages, excuse me. Wendy, do you want to start?
Unmute. I think they're incredible opportunities. I've followed and seen some of the very successful ones. My board right now, if I said we wanted to take on something else right now, I think they would tell us no. But, you know, in the future, when we're, you know, got things set up right here, possibilities. But I think it all goes back to location. Finding location in our community would be the biggest hurdle. And look at what Jana's faced in South County. I mean, every time I come into Echo and Atascadero, it's a miracle, because we are in an area that I just cannot believe the people that came before me got this shelter next to 2 high schools with housing all around it. And in our current climate, the struggle would just be so hard. You know, at some point, I think someone's going to have to take on that struggle, but right now we just don't have the capacity, but it's an incredible idea.
And Jana or Grace, do you want to contribute to that? Yes, go ahead.
Go ahead, Grace.
Well, I was going to say, I agree. You know, we're trying to deal with encampments and safe parking locations, and it comes down to location. I know that there are currently groups that are trying to do tiny villages and tiny homes, and again, it's a place to put them. So we're not opposed to it, but right now our focus is safe parking. That's kind of our niche. And we're trying to just work with our local municipalities to find safe parking locations.
And at 5 cities where we are currently looking at that, we have been exploring that, pricing it. We've been in conversations with several providers that provide those things, but our agency is willing to look at it should someone have a location. And that's the caveat.
Okay. And this is a question, why isn't the money coming?
So
if you can answer that, that would be amazing. Jana, go for it.
Well, so Congress said, we have this money. We want you to respond quickly to the COVID emergency. Our federal, state agencies, local government agencies have endeavored to respond within the governmental process, which requires vetting and contracting, all of that. But once they did all of that, then they had to go back to the funding agency, the state or the feds, and say, this is what we want to do with the money. And then the state or the feds has to say, yeah, that sounds like a good plan. Okay, go forth and conquer. And then eventually the contract happens, and then eventually the money comes. So it just is the nature of the process, as far as I can tell. And I don't mean to throw anybody under the bus, but asking government to work expeditiously is not by its nature, because it's a very conservative process. And so that's been the challenge.
And Wendy or Grace, anything to add to that? No. Okay. Here's a question about which you may have touched on, but the question is, please talk about what specific needs your agency has: funding, volunteers, supplies, ideas, advocacy, etc., and how we can help out.
And the next question is the same.
All of the above. No.
And thank you for asking that question,
Yes.
because we are still having volunteers physically come. We are providing the safest environment possible with working with public health and CDC guidelines. So we do critically need volunteers. And if you've never been to Echo or to any of our facilities or our programs, you get more out of it than you give. You really do. Serving dinner here, you'll hear more thank yous in an hour than you hear, in a week in normal life. The people we serve are grateful. So if people can reach out, I'll put my, I wonder if we can follow up with folks and send our contact information so they can reach out if they're interested. But I guarantee you will get more out of it than you provide. But we're grateful for anybody who's stepping up and wants to help.
Yeah, we are going to provide that at the end of the webinar, contact information for all of you. But one of the questions here is, what are the ways that volunteers can help, and what are the safe ways that volunteers can help if they want to do something right now? Yes, go ahead, Jen.
Let me chime in if I can. We do have safe ways with hands-on stuff. I think each of agency could probably talk about that. We have a lot of things put in place, but the word advocacy was used, and I really want to address that, because typically that means advocating through the government process or something. We actually have great relationships with the cities and the county, because they're all struggling to address this as well. But I think the issue of advocacy within the community to embrace this challenge, we don't have all the answers. We're here at the table to work as hard as we can, but this is a collective discussion and challenge that we have, a humanitarian challenge, if you will, as has been said. And so, I took a call this week from someone asking why we needed to have a warming center. And I was like, do you know that people are passing away on the street because of the cold and the rain? And we had a very thoughtful conversation. But what I'm recognizing, and I think Wendy mentioned it first, is people don't understand. I mean, I'm thrilled that we have the number of folks who are on tonight as have joined us, because the education piece is huge. But what I would say, we are going to be probably doing a point in time count. It's a one-day thing. There are ways that certainly you can have fundraisers, birthday party fundraisers, whatever, to support. We all have individual opportunities, I think, for hands-on volunteer needs. But really helping people understand what we're talking about tonight and why we cannot turn our back and we must respond would be my greatest ask.
Actually, Marlys, if I could tag team on that with Jana, the encampment issue and the parking issue has kind of taken a lot of energy in the discussion as of late, and it is a polarizing set of issues. I don't think anyone would deny that. I've participated in Zoom meetings where we had an equal number come out in force. Those that would have sided with that comment, why do you even, they need to go. They shouldn't even be here. We shouldn't have to deal with that. It's, it's bad for our community. My kids can't walk down in the area because there's needles, blah, blah. And then on the other side is an equally vocal camp that says, where's your compassion? These are human beings. And I think the issue for us is that we need to have collectively a transparent discussion about at first acknowledging that there are those two sides, because I don't think we can come up with a collective county-wide consistent policy until we do that. And I hope that those discussions will happen, because the need is getting worse. And we've talked about it at the various HSOC meetings, that we can't just have a Morro Bay initiative and a Tascadero initiative, because this is a county-wide initiative. This is a county-wide discussion. So I think until we can really come to terms with the fact that, yeah, there are two polarizing issues, and we got to figure this out, folks, we're going to have this problem.
Right. And Wendy, did you want to add?
I loved how Jana took the word advocacy to kind of advocating for the people we serve. In traditional world, when I did presentations in person, I would always end with that hopefully you learned something today, and hopefully you pick up on some things where the next time you hear someone dehumanize someone that's unhoused, speak up, be a voice for them, because, we hear so many voices against that population, which, if there's not a place for them to go, what are their options? 74% of the folks in our county were born and raised here. The next number, they were here for specific ties, family members, came here for a job. It isn't, if you build a resource like a homeless facility, people are going to flock to it. That misconception just isn't reality. So you advocate for the people we serve, and that will go a long way. And definitely need volunteers. Overnight chaperones are really crucial right now. So if someone's willing to come spend a night here at Echo, it's safe, and you have conversations with people that will, really help you understand. It can be, anybody in these walking in their shoes. It can happen to anybody if, the right tsunami happens. So yeah, we would love volunteers.
Okay, and here's somebody who wants to donate coats and sleeping bags, and they haven't figured out how to do that and where to do that. So they'd like it to, yes, Grace has got the answer. Okay, go ahead.
It's on our needs list. Come to Forty Prado any day between 8 a.m. and 6 p.m. and we will gladly relieve you of your sleeping bags and coats. Those are actually our two biggest needs right now.
And Wendy, do you have the opportunity to do that?
Yeah, we actually post our wish list. We change it quite often because it changes depending on the season or, what we currently need. We really love people reaching out and asking what we need and not showing up with things we unfortunately can't utilize. Donations are an interesting thing to navigate in our world. If someone shows up with a refrigerator and we have no place to put a refrigerator, so please call, and we don't want to take something that's useful for someone else when we can't use it. So yeah, check our wish list. Sleeping bags, coats, underwear, clean, brand new underwear is a critical need constantly, and it's just not thought of. So thank you for those that are wanting to help. We really appreciate that.
Okay. And Jana, did you want to add?
I'll ditto. We tend not to give out sleeping bags because we don't want people being encouraged to sleep where they shouldn't. Although, as you say, I don't have a shelter, so I'm kind of in two different places. What I will say in terms of donations for our warming center, we are desperate for sweatpants, sweatshirts, new sweatshirts, sweatpants, and underwear. As Wendy mentioned, people come in, they're wet, they're cold. We want to put them in clean, dry clothes to both walk around with and then be able to sleep in.
Okay. And I might add that in Morro Bay, we have a Community Resource Connections office, which is at the Visitor Center, and they accept donations there. So that's our only real service for the homeless in Morro Bay, unfortunately. Okay, here's a question. This is from someone in Los Osos. We recently had a possible COVID positive person using a public park restroom. What should be the response to keeping park goers protected if the person will not accept a room or trailer?
Well, I actually was aware of that issue and talked to some very concerned citizens in Los Osos.
Okay.
And, the issue again comes down to if they are considered to be sound mind. And it's very difficult to 5150 someone. I mean, you're basically taking all of their rights away. Then they do have a right to refuse services. If someone is exhibiting COVID symptoms, they need to go to the emergency room, which is what I said, because they gotta get tested. And there really isn't an immediate test. This individual stated that there was a positivity, and yet we're not sure whether that was an accurate statement or not. And so, to my understanding, paramedics had been called, public health had been informed, which would certainly be the next step. So services were offered. And again, if the individual chooses to not avail themselves of them for whatever reason, there's not a whole lot that can be done. And that's the frustrating thing, I know, because the community is seeing this and they want to know, well, why isn't something being done? Well, things are being done. But again, that person has the ultimate human right to be able to make those decisions.
Okay. Thank you. Thank you. Okay, how have the local police jurisdictions provided their input on dealing with the homeless issue? Who wants to take that? Okay, Jana.
A couple things I'll give a shout out. I believe you are looking at potentially having a subsequent forum on this issue, so I won't address it too much, other than to say we have excellent relationships and daily conversations with certainly the various folks within our jurisdictions. There have been changing laws as to what public law enforcement can do, what their role should be. And they will be the first to tell you that they are not mental health responders, although they are all being, I think, expertly trained in mental health crisis intervention. And they are certainly aware of the encampments. They are also aware of the challenges with regard to COVID and moving people around. And so they, as I say, we're having daily conversations, and we are a connection, trying to do outreach and work with them on those issues.
Yeah. Okay, and I do think that this is a critical issue that really needs a separate webinar, because the law enforcement agencies obviously are intimately involved with this issue and deal with this issue on a daily basis. And we do need to understand more their constraints and how they handle situations. So I'm gonna move on to the next question here so we can get them all in.
Last question.
Okay. Oh, the last question, well, how do we get meetings where people can openly express their concerns of both sides? It's not happening.
Well, I think first it would take, again, it's a county-wide response. I do believe that there is a desire to begin discussions after the first of the year. I hope we're asked to come to the table and participate in those discussions if they are going to happen. I think that it needs to be dealt with, and I don't know why. Truthfully, I'd love to know from that whoever asked that question what their thoughts might be. Is this a grassroots effort? It's certainly an advocacy effort, but those discussions I think need to be happening, and I think as many people need to come to the table. So perhaps the Women's League might want to have a forum on that.
I can say from our perspective, we really try to provide opportunities for conversation, not just, us talking. And so, prior to COVID, we had already started some public forums. We had a very successful one in Paso Robles, where we invited the community to listen and then have a voice as well. We did the same when we opened our emergency winter shelter here in Atascadero, and we are always open to whatever venue that is the right venue to have those conversations and learn from each other. So it's something we're definitely open to.
And I'll just add, one of the things I think it's starting obviously with this conversation and a better understanding, but I think that there's on some levels just some basic assumptions about what can be done or should be done. And I think, for example, you will learn from the law enforcement folks, there aren't a lot of options that one would typically think of. And so we have to come up with some new ones. And so I would encourage people to come to understand what the challenges are, not only for those who are homeless, but for those that want to respond to the crisis. And, truly for me, it's upstream. Let's have some more housing, please, and let's work on job development. But I would go back to the self-understanding and education, and coming to understand some of the challenges of it's very complex, and as you can see, it's very multifaceted.
Well, listen, I've been getting the word that I have to wind this up and transfer this back to Cindy Marie, but I want to thank all of the panelists personally. It's just been great, and you've all been great. So I've really enjoyed it, and I'm going to let Cindy say farewell and next steps.
Thank you, Marlys, and thank you, panelists. Wow. Our community is so fortunate to have the three of you, Wendy, Jana, and Grace, working so diligently and so passionately to meet this humanitarian crisis. It's truly inspiring. Just your scope of knowledge and experience, and the hope that you continue to feel and to communicate about this enormous and growing problem. The League salutes you and your staff and your organizations for the life-saving work that you do day in and day out to help people without homes or shelter, something that the rest of us really take for granted. And we are also so grateful to Marlys McPherson for smoothly navigating and facilitating today's panel. Thank you, all four of you. And we now, the League members and community members who joined in this panel presentation today, you've given us the basic tools to begin to understand homelessness and to formulate future plans and advocacy. So thank you. Planning for today's panel was handled by the League's program committee, notably Chair Deb Humphreys and Glenn Silloway, who are also spearheading plans for future panels that will include the role of law enforcement and first responders, special populations such as veterans, and emerging trends with homelessness, trends the three of you talked about today. Thank you also to League Communications Chair Jordan Blaquera and her team, including our Zoom guru, Dave Humphreys. Finally, thank you to League members and community members who joined in this panel presentation today. Armed and with the knowledge and working together, we can help create better lives for the homeless and the unsheltered in San Luis Obispo County. Now, please stay tuned for contact information that we promised that we would post on the screen for your future reference, and that's coming right up. Thank you again, and everyone have a great evening.
Thank you.
Thank you.
Thank you very much.